Can online resources provide useful tips for managing pain? Patients often seek information online to manage their pain. While credible online resources can be valuable tools for education and self-management, misinformation is also widespread. As healthcare professionals, we must help patients navigate online content, ensuring they access evidence-based, reliable information that complements their treatment. What does scientific evidence say regarding health-related online resources? 1. Variable credibility and readability on websites. Many online pain management websites, including Google-based searches, often lack sufficient credibility. The Journal of the American Medical Association score, JAMA score, is used to assess the reliability, and the Health on the Net Foundation Code of Conduct, HON code, is used to assess quality. In a large study, less than 30% of the websites met full JAMA criteria, and over 60% were not HON code certified. Additionally, they are sometimes fairly difficult to read for the general public, suitable for ages 15 to 17 years. 2. Accuracy and comprehensiveness issues. Freely accessible non-commercial websites frequently provide inaccurate information and lack comprehensiveness regarding evidence-based treatment recommendations for conditions like low back pain. One systematic review found only 43% of website treatment recommendations were judged as accurate. 3. Social media, misinformation risk. While social media platforms like YouTube can be an accessible source of information, the quality and accuracy of health information, including pain management tips, can be highly variable. 4. Lack of self-management support in apps. Many commercially available pain self-management apps fall short in incorporating robust features for self-management support and behavior change. A review of the literature found that apps met a median of only 4 out of 14 criteria for self-management support. And 5. Need for curated and tailored content. Users desire freely accessible pain management information that is reliable and tailored to their specific needs and pain type. This underscores a clear gap between currently available online content and patient demand for high-quality, personalized advice. How can you address the topic of online resources with patients? 1. Select trusted online resources. Recommend specific websites, educational videos, or apps that align with evidence-based pain management. 2. Teach patients to evaluate information. Encourage looking for sources with medical expert input, scientific references, and balanced discussions of risks and benefits. 3. Integrate digital learning into clinical care. Use online resources as an extension of consultations, allowing patients to revisit key concepts between sessions. And 4. Guidance on balancing online and offline information sources. Underline that online information should complement professional guidance and never replace it. Let's put it in practice. Sophia is a 38-year-old patient with persistent neck pain. She finds it hard to remember everything discussed during in-person consultations and often looks online for advice.
Sophia, we covered a lot today in your session. I know it can be difficult to remember everything. Would you be interested in knowing how to find reliable online resources that reinforce what we discussed?
That would be great. I've looked online before, but I see so many conflicting opinions.
That's a common challenge. There's good information out there, but also misleading content. I've put together a list of 3 criteria you can consider in order to identify reliable information and online resources about pain science, safe exercises, and self-management techniques. These will support what we're doing in your program. 1. Source and authorship. Who provides the information? Check for clear identification. Look for the author's name, their professional credentials, for example, MD, PhD, physical therapist, and their affiliation, for example, a university, hospital, or recognized professional organization. Assess the website's reputation, Prioritize information from well-known medical institutions, governmenthealthagencies.gov, established nonprofit organizations.org, or reputable professional associations. Be cautious of commercial sites.com that don't clearly state their medical review process. 2. Accuracy and currency. Is the information reliable and up to date? Look for evidence. Does the content cite scientific studies, clinical trials, or established medical guidelines? Are there links to research papers or a list of references? Claims should be supported by research, not just personal stories. Check the date. Look for a last updated or reviewed date. Medical knowledge evolves, so information that is several years old might be outdated. Is it balanced? Does the resource present a balanced view of treatments, including potential risks and benefits, or does it exclusively promote one specific product or method? 3. Purpose and disclosure. Why is this information being shared? Identify the goal. Understand if the website's primary purpose is to educate, or if it's trying to sell a product, service, or promote a specific agenda. Look for conflict of interest disclosures. Reputable sites will clearly state their funding sources, any commercial affiliations, and whether authors or editors have financial ties to products mentioned. Be wary if a product is heavily pushed without such transparency.
To sum up, when guided by healthcare professionals, online resources can enhance pain management by reinforcing education, tracking progress, and supporting self-management. Helping patients access reliable digital tools improves engagement and treatment adherence while reducing reliance on misinformation.